Tell me what is that? If bicarbonate should be 24, but it is 18, so what is your diagnosis? pH is 7.33, a bit lower side, you can say. What to say? What do you think about this clinical scenario? What do you think about this clinical scenario? Is it metabolic acidosis? It is metabolic alkalosis, respiratory acidosis, or respiratory alkalosis? What do you think answer? See, it is 40 mmHg. It is 40 mmHg. So it is not a problem. It is normal. Problem is with bicarbonate. So it is metabolic acidosis. There is some problem when there is a metabolic acidosis. Okay. Now, which of the following condition does this patient more likely have? Hyperreninemic hyperaldosteronism, type 1 RTA, type 2 RTA, type 4 RTA. It is a wonderful question. See, when there is normal anion gap metabolic acidosis, there are mainly two causes. Either it can be diarrhea or it can be RTA. What is RTA? Renal tubular acidosis. RTA1, RTA2, and RTA4. You must always know this point. RTA1 is what? It is DCT defect. DCT and collecting duct defect. Problem is with the proton secretion. Problem is with the proton secretion. Okay, so there is problem in the acidification of urine. So in RTA1, problem is with the defective acidification of urine. Defective acidification of urine. So when there is defective acidification of urine, which normally happens where? Collecting duct. What is that RTA? Very simple. RTA type. RTA type 2 is proximal convoluted tubule defect. There is problem with the bicarbonate reabsorption. So when there is problem with the bicarbonate reabsorption from PCT, it is called as RTA type 2. But RTA type 4 is due to hypoaldosteronism. And when there is less aldosterone, hyperkalemia will be there. And the only RTA where potassium is more is RTA type 4. In this question, you can say potassium is bit on the higher side, metabolic acidosis. So what is your answer now? The only RTA. See, I can discuss this question at least for 1 or 2 hours, but purpose today is not to discuss in much detail. In the exam, you have very less time. So purpose of today's discussion is how to approach in the exam. So few very key point you must remember. For example, RTA4, the only RTA which has hyperkalemia is RTA4. It is because of hypoaldosteronism. So answer will be D. In RTA1, RTA1 is due to there is no acidification of urine or defective acidification of urine. In RTA2, problem is with the bicarbonate absorption. So the only RTA, the problem is the kidney, hyperkalemia is there. So you can see what is correlated with the question. Then in the exam, you are not supposed to write about what is the RTA1, 2, 4, but at least you must know RTA4 hyperkalemia, RTA1 collective tubule defect. Yes, you are Dr. Tachycardia, you are correct. Type 1, very good. Very good mnemonic also. When you write 1, it becomes stone. Stones are found in. Kidney stones are found in type 1. Okay. It is also very common question. Kidney stone or renal stones are found in. Answer is type 1. Okay, very nice, Dr. Tachycardia. So answer is stone. Yes, it is bit high. I know it is normal. A bit high. A bit, you can say, on the higher side. Okay. Metabolic acidosis is there. Now, a primary gravida woman at 30-week gestation has been diagnosed with diabetes mellitus.